This resource is particularly designed originally for GP registrars, which is doctors in training to become GPs but who aren't fully qualified GPs yet. Having said that, that's what it was developed for, but it's absolutely open to any health professional who might find it useful. You just have to insert a different word instead of registrar whenever you hear that mentioned in the resource. It's particularly aimed at people who are new to working in an Aboriginal community-controlled organisation, so not only remote services, even places in Darwin and Alice.
Like Danila-Dilba and Sunshine Health
Dilba and
groups. Yep,
exactly.
Okay. Yep.
In fact, Danila-Dilba is one of the major partners in developing the resource. It was a partnership between them, ANSANT and NTGPE. And it really grew out of a learning need of one of our trainees who was working between Danila-Dilba and ANSANT and having quite a bit of culture shock in that new environment.
Yeah.
And so what the resource consists of is she went on and interviewed quite a range of people with a lot of experience in Aboriginal health, ranging from Aboriginal and Torres Strait Islander health practitioners to CEOs of places like Danila-Dilba and Congress, GPs who've worked in Aboriginal health for a long time, other trainees who were a bit further along than her who'd had more experience, and even community board members talking about what they see as special and important about community control. And then it's been turned into this really quite easy to use and beautiful artistic-looking online thing, divided into 5 main areas. So you can explore each area independently. You don't have to do them in order. And they talk about what's different about community control compared to mainstream general practice. What is the role of the health practitioner or health worker in that situation? What challenges might there be for you? What are some common misunderstandings? What's some good things to know before you do start a term? And you do that by clicking on little cartoon avatars of the people who are interviewed, and you can either read what they had to say or listen to their voices telling you what they reckon about things. There's also a really good reading list and resources list, and all of it's designed so you can print things out. Once you've done your workshop bit, you can print it out and take away to discuss with others or think about further.
I mean, that's really interesting, because I guess a lot of the especially the residents and that, but a lot of people who are qualified or freshly qualified in medicine, or have been practising as a GP in other centres in Australia, especially the urban areas of Sydney, Melbourne, those sort of areas. It really is a big change to move to an area like the Northern Territory and some of the working for some of these organisations, totally different to any past experience, totally different to what they've learnt previously. Is it the sort of thing that maybe should be moved into some of the training at in a tertiary level that may be a good thing to start with?
Well, it's certainly available. One of the really nice things that the organisations who've created have done is made it freely available to anyone, so you can just get to it as long as you've got web access from the websites of ANSANT and NTGPE, and I think we will have it on Danila-Dilba's as well, and explore from there. So if there was a tertiary program like the medical program, for instance, at the Flinders Uni, who wanted to use some of this as a teaching tool with their students, it would be absolutely possible. Some of it, I think, becomes more relevant once you're in the environment, though. I think it's not always going to be about beginning orientation. It might be about after you've had a bit of experience reflecting on what that's been like and yeah,
good stuff. No, good on you, Natasha. I mean, all these things are important because they are trying to, I guess, encourage and support health workers in unique situations, and we need all our medical professionals to stay and work in their jobs for a longer time and get greater enjoyment and have better sort of synergies with everyone involved. So that this is a sort of thing that help support that. I thank you for joining us and giving us a snapshot.
Thanks for the time.
Good on you. Natasha Pavlin there, Dr. Natasha Pavlin, talking about the new, it's a program, it's an online learning tool to assist doctors working in Indigenous